I'm Dr. Don Bonner with Personalized Wellness. Today we're going to talk a little bit about diet and nutrition. This is just an introductory video to kind of introduce the topic. And diet and nutrition is part of my lifestyle medicine portion of my program that I run here at the clinic. When somebody comes here at the clinic for a consult, we do the typical thing that every doctor does. We get a good history. Our history takes quite a while because we get very in-depth as far as when these problems started and that sort of thing. But then allergies, medication, past medical history, past surgical, everything's going to be very much the same. After that, the diet and nutrition portion of the lifestyle medicine is really the first thing that I focus on. And then we'll talk about sleep, stress management, exercise, all those things I consider lifestyle medicine. Diet and nutrition. I think the biggest thing about diet and nutrition is that there's a million diets out there, folks, and it's very complicated. Everybody's a zealot for their particular diet, and this diet is the only way, yada yada yada. And I'll tell you that your diet needs to be personalized to basically where you are right now, and that's really what I do. Now, I will say, I probably use the ketogenic diet in probably 85 to 90% of my patients, just from the fact that most of my patients that come to see me, there's metabolic derangements going on. They need to lose weight. They're pre-diabetic, they're diabetic, they're insulin resistant, they're hypertensive. And I think that the ketogenic diet, along with fasting protocols, which we'll talk about in the next video, is the fastest way to get these patients healed and to get them better. But you can see all sorts of diets out there. There's ketogenic diets, Mediterranean diet, paleo, Atkins, modified Atkins, vegan, vegetarianism. The latest one is the carnivore diet. That's meat only. These people eat nothing but meat. So there's a lot of stuff out there, folks. So again, you need to be a bit personalized. If I get a person in the clinic that's an athlete, they're doing CrossFit 3 days a week, they're at ideal body weight, well, that patient, I'm going to recommend more of a higher protein diet, such as a paleo diet, which would be very appropriate for that particular patient. But again, you need to personalize it. We're going to get really in depth in the coming weeks with the ketogenic diet. We're going to go into it, like I said, deeper than probably you want. We'll get into the physiology of insulin resistance and fatty liver. That'll take multiple videos, but so we're going to be on several videos on this diet and nutrition portion. Next week, I'm going to talk about fasting protocols, which is a big part of my program. We'll kind of demystify a little bit of that next week. Hit the subscribe button down below. Click that little bell so you get a notification when my next video is uploaded. And I appreciate you supporting us, and thanks for watching, and we'll see you next week. Thank you.